Welcome to the checkup. I'm Jessica Kim Cohen, Modern Healthcare's technology and innovation reporter. Digital transformation has become a core priority for many health systems. But while most health systems say it's important for their organizations to invest in digital transformation, nearly 80% say they're in the early planning stages and haven't yet implemented such strategies, according to a survey by the Healthcare Information and Management Systems Society. A separate poll from West Monroe found the most commonly cited challenge the healthcare industry faces when rolling out digital strategies is attracting and retaining talent. Today, we have Myra Davis joining us to discuss her role leading innovation as Chief Information Innovation Officer at Texas Children's Hospital. Welcome to the checkup, Myra. So, to start off, you added innovation to your title at Texas Children's in 2019. Previously, you had held the role of Chief Information Officer, and before that, the VP of Information Services. So I'd love to learn a bit about, how did that come about? How was that additional innovation piece added to your responsibilities?
Yeah, sure. So I would say it was really not Myra's thinking whatsoever. It was just the innovation, thinking, and brilliancy of our CEO and President, Mark Wallace. He recognized and appreciated, along with his executive team, the advancements of how we have leveraged not only the functionality of our electronic medical record, but the integration into other solutions and the advancement that we have been able to move the organization in when it comes to leveraging data. And so it was really his intuition that birthed the additional I in my title as the Chief Innovation Officer. I will tell you at the onset of that introduction of my title, it was really important for me to work with the organization to define what does innovation mean in our organization. And really, at the end of that exercise, it was very apparent, one, that innovation was everyone's responsibility. Just because I had the word in my title, it did not mean I was the only person to think innovatively in our organization. Texas Children's has been innovative in inception and continues to be innovative in terms of how we actually care for patients or even leveraging technology. And the other part of it is that at the root of the word of innovation, it means really to change. And so for me, as I reflected, it became a matter of how do I partner with our executive team to ensure that we are leveraging technology to change operating practices, to change and enhance how we care for our patients and how we care for our workforce. And so that's a really long way to talk through how my title changed, but it was really the birth of it from our CEO and president, but more importantly, the understanding of it has been with partnerships throughout our organization.
Mhm. Yeah, and I love that way you defined innovation as, changing the way you're doing things, whether it's clinical care or workforce. Could you give me an example of an innovation project that you've worked on that expanded beyond what would have typically been considered under the purview of the chief information officer?
Yeah, I'll tell you, the way we really go about it is working closely with our organizational executive partners and clinical leaders. And one example has really been leveraging telemedicine. I know everybody's doing that. And we actually started prior to the pandemic of leveraging telemedicine for the purposes of video visits, for convenience for our patients, and opportunities for our providers, and really mitigating our patients' need to have to drive into the medical center. But through the efforts of the pandemic, it afforded us an opportunity to accelerate to where we have opened up the ability for online scheduling of video visits through our portal and our platform. So that's an example. Another example has been leveraging robotic processing automation. Again, the technology has been around for quite some time, but as we looked at opportunities to create efficiencies in operating models, it afforded us a chance to partner with our clinical leaders and operational leaders and introduce the technology in partnership with opportunities that they may have to change maybe the way the workforce has been working historically by leveraging such technology. So it affords us an opportunity to introduce some technology solutions and think through how could it change or how could we create changes, whether it's in practice visits or in operating in operating models, and create some efficiencies. And so those are two examples that really, again, the technology has been out there, but in introducing it in partnership with operational practices has afforded us an opportunity to create change.
Mhm. Interesting. And a couple of things I wanted to, I guess,
Sure.
dig into there. You mentioned a couple of the ways you're interacting with patients. And I guess with Texas Children's being a children's hospital, I'm sure you're seeing a lot of the parents of the children who are patients that are millennials, probably increasingly Gen Z. Anything you've noticed about the way those parents like to interact with the health system that might be different than previous generations?
Yeah, and I also want to clarify, we are a children's hospital, but we also care for women. So we are a women's hospital as well. And so with that said, and that's the beauty of that, is that the women who have babies here, they too are in that population that want to seek convenience not only for themselves, but in addition to themselves, how do we care for their kiddos and create convenience? So with that said, we also accelerated really exploiting all the functionality in our portal, which afforded us an opportunity to expedite creation of online appointments. How do we make it easy? Not only creating online appointments, but when you have the inability to get an appointment, how do we put you on a wait list automatically? And when an appointment becomes available, it slots you in. Also, notifications of reminders of when it's time for you and or your baby to get care for. We send out notifications. We also afford you an opportunity to complete as much of the questionnaires and paperwork that's required of us. We allow you to do all of that online. So we really exploited the functionality in our portal. And the impetus for that was to your question of creating convenience, creating it in an automated way that simulated itself to other industries that have created their online portals for convenience. And so we wanted to simulate as much of that as possible. And it's not just for new millennials, it's for anyone. And we really just want to create it in a way that's ease of use, that's convenient, and that's really understood.
Mhm. And of course, you've touched on a lot of different types of technologies, and these are projects that will affect people throughout the health system. Was wondering, what teams and staffers do you lead at Texas Children's as part of your innovation work?
Mhm. So I have multiple teams actually. So I have an innovation team that their role is to partner with the organization, because innovation is everyone's responsibility, as I said. Their role is to really partner with the organization on what are the opportunities we have, what problems are they trying to solve, and more importantly, do we have the assets in our portfolio today to solve for those problems? And the reason for that is, if we do, how do we ensure that we are aligning those opportunities to the existing roadmaps that we have in place? They're also looking at possibilities to partner with outside companies that aspire to partner with Texas Children's to create products or even enhance existing products, leveraging Texas Children's data. We have a rich data source. We know that it's attractive to many startups or existing companies. And so that their role is to create partnerships there. They also work internally with the rest of the technical teams to ensure that they are well aware and abreast of the new and upcoming advancements of technologies that we currently own, and explore what opportunities could they solve that the innovation team is aware of from their portfolio. So it's more of a bi-directional opportunity we have. In addition, we partner closely, as I said earlier, with our executives and clinical leaders with creation of an innovation advisory group, where we meet with them periodically to understand and to also give updates on how we're performing in the portfolio, but more importantly, to understand what other opportunities do we have to solve for. So it's a multitude of ways. It's one team, but it's one team that works with many existing teams, internal and in the information services department. And there's a total of 560 people, or close to, that they have access to really help bridge the gap of solutioning, identifying solutions that could solve opportunities in the organization.
And for that innovation team, I guess, how do you go about recruiting the staff that are on that team? What kind of skill sets are you looking for?
Not necessarily, they don't need a technical background. They need more of an inquisitive nature background. The ability to ask questions, influence, and really work from the lens of a startup. Not everything is defined, but we're looking to them to go out and just seek opportunities, not be afraid to meet people. So a lot of courage. We have some really talented individuals on that team that's really skilled at doing that. And they've been great partners to the internal rest of the IS team, as well as the organization.
Interesting. And you mentioned that innovation team will also work with other folks in the health system to kind of figure out what their pain points are and what problems they're working on. I guess, how does that process work? What types of other staffers at Texas Children's are they kind of working with regularly?
A really good example recently, and we're still in the exploration phase of it, but we're aware that our pathology department was really looking at some opportunities to explore digital pathology. So really this team, my innovation team, really went out and talked to the pathology department about what the opportunity looks like. And then we partnered with a third party cloud solution vendor. And we're in the beginning phases of exploring how to solve for it. But that's a way of marrying a potential problem that we have to solve with the solution that we're exploring. And again, to the credit of this team, as I said, because of the inquisitive nature and talents that they bring, it's really neutral in their ability to marry the two, because they're not technical, so they're not going to be inclined to try to solution. They're really inclined to try to solve the problem that they're hearing about, marrying the opportunity to the technology solutions that exist.
Mm-hmm.
So the partner is the pathology department.
Mm-hmm. Mm-hmm. And let me see. This will, of course, vary case by case, but you've also talked about partnering with third parties and outside startups. Mm-hmm. I guess, what does the vetting process for that look like? Of course, especially when you're sharing patient data, that concern that your goals are aligned with this startup, I'm sure comes up. So just how do you think about that?
No, that's a really good question. We actually have an onboarding process. So before we engage directly with any vendor, we work very closely with our information security department and legal and the contracting department. So those are three key critical partners for us to ensure that we are protecting our information, we are protecting the organization through these types of partnerships as well. And so that's a pretty significant due diligence that we take before exploring any partnerships externally.
And really the last question I have is, what support do innovation-focused executives like yourself need from the CEO and from other C-level executives at hospitals to really be able to pursue innovation projects?
I want to encourage that. I don't think it's, let's not just isolate that word innovation and make it such a differential that it creates, believe it or not, it creates a cynical, it creates some degree of condescending behaviors on the one side. I think it's really important to appreciate that while it's in someone's title, it is really the responsibility of there's a lot of smart people in many organizations, and everyone's innovative because they're all thinking about, how do I make a change in my organization? How do I make a change leveraging certain technologies? So I think it's incumbent on to have the position of partnering to talk through that. Because you, as a leader, whether you're a CIO, whether you're a non-CIO, you're trying to drive certain degrees of change, and marrying what your opportunities are to the potential solutions, technical solutions that your organization may or may not have is really what I would encourage everyone to consider a path to take, regardless of what your title is. I think that's really important to emphasize.
Definitely. Well, thank you so much for joining us today, Myra. And for those watching, thanks for your support and for listening to the checkup.
Thank you for having me. I appreciated the time.